and your blood pressure will start coming down already. It's the same thing for physical activity. We don't have to go from sedentary, from sitting, to master's level. You know, we don't even necessarily have to break a sweat. We just need to get up and do moderate activity. And that is where there has been the most benefit and the least safety issues, the least injury to our bodies, and the best benefit. And smoking cessation, it is about nicotine and what it does to blood. Very important, at least to into a smoking cessation program. Get some help. Nicotine is probably one of the more difficult addictions. And it is an addiction. There are receptors in the brain that are there and wired for nicotine. And unless they're fed, they get very uncomfortable, and they make us uncomfortable. Jittery, sweaty, irritable, all the things that we feel about withdrawal. And so it is impossible, probably, to taper off and stop because the body will always need a certain amount of the chemical. But there are excellent, excellent programs, the Wellness Committee, here and other places that can help. And there was a patient that I took up in my private practice, an alcoholic, and he smoked. And he was very committed to his health and was able to get off alcohol. And then he still smoked. And so when he came to me, he said, you know, I got off alcohol all right, but this smoking thing, this is tough. It shows you just how hard it is. So please, if you smoke and would like to stop, please get some help. And moderation of alcohol intake, because actually drinking too much alcohol can increase one's blood pressure. Now, what is a moderate amount if you do drink alcohol? It's 1 drink for women, 4 ounces for women a day. For men, that's 2 drinks of 4 ounces of alcohol. And that's different whether you're drinking beer or liquor. But it is important to moderate the alcohol intake as well. So in treatment, the most important treatment factor is our lifestyle. It is what we decide to do for ourselves. Because as it turns out, can anyone else make our decision for us about a behavior change? Doesn't work, does it? Anybody who has children understands that? We want a great deal for our children. We want to make sure that they do as they're told and that they live a good and healthy life. And we know that unless they are committed, as much as we're committed makes no difference. But that is true for each individual. Each of us must commit to our own health. And in achieving that balance, that healthy lifestyle, actually this is the most important treatment. It's not just important treatment for hypertension. Turns out it works for almost disease as well. But there are other treatments. Lots of pills. Lots of pills. I haven't bored you with extending this slide to include all of the trade names of all of these classes of antihypertensives. But I will say just a few things about some of them. The thiazide type, this is HCTZ, hydrochlorothiazide. You may have heard about it if you're in the medical field or an NA. You will certainly have probably run into it. Thiazide diuretics actively work on the kidneys to help decrease fluid, basically. So fluid called edema. These actively work to pull fluid into the kidneys and to get rid of it. Unfortunately, while they're getting rid of the fluid, they're also getting rid of sodium. Not necessarily a bad thing, but they're also pulling out your potassium. Not a good thing to get rid of, because our muscles, including our heart muscle, depends on potassium at an appropriate level to function well. So the drawback for thiazide diuretics, or any diuretic, They're also called loop diuretics that are sometimes used. The drawback is that the potassium can go down, and sometimes you have to end up taking a second pill to correct your potassium. Or you can try eating a lot of oranges and bananas and cantaloupe and some other foods that are rich in potassium as well. However, the thiazide diuretics, some of the oldest medications around, certainly the cheapest. You don't even really want your insurance to kick in because they're like $5 for a month's supply. Pretty good. They are useful because they are inexpensive. They are useful because they work. And as it turns out, they are the most commonly prescribed of all of the antihypertensive treatments. The studies lately have shown that actually that's a good thing. For a while, we started developing all these other medications and then realized that going back to the thiazide diuretics was actually a very good thing. So now, most studies recommend that if one is started on medication after they have achieved that healthy lifestyle, that if they need medication to get to a good blood pressure control, then they ought to start with thiazide diuretics. They are also extremely good in African Americans. And converting enzyme inhibitor, mouthful, such a mouthful. These are inhibitors, ACEI. These actually work on this very powerful chemical called angiotensin II. Angiotensin II is secreted by the body, and its major effect is to constrict the blood vessels. So obviously, remember we talked about early on, we really don't want those blood vessels to be narrow, do we? We want them to be open so it's less pressure to get the blood through. Well, what these do is they actually block the enzyme that makes the angiotensin work. So they keep it from working. There are also things called ARBs, which are very close to the ACE inhibitors. These are the angiotensin receptor blockers. Well, they don't stop the body from making that enzyme to convert it where it's going to be used and cause the blood vessel to constrict, but they actually stop the receptors from picking up that chemical. Both of these are very common. They're commonly used. They are actually excellent. Excellent particularly in kidney disease and diabetes. They can improve kidney function in those who have diabetes, even who do not have hypertension. So you will see them often used there. The